Are dry eyes and dry mouth always the result of Sjogren syndrome? Are your widespread body aches coming from Sjogren syndrome? The answer to this question may surprise you. Sjogren syndrome is a widespread autoimmune disease that affects primarily the gland, but it also has symptoms that are outside of the gland, and these can cause Sjogren syndrome to be confused with other diseases. Here are 5 diseases that can be confused with Sjogren syndrome. Number 1, rheumatoid arthritis. Just like Sjogren syndrome, rheumatoid arthritis is a systemic autoimmune disease and shares many of the features of Sjogren syndrome. After dryness of the mouth and of the eyes, inflammation of the joints is the second most common symptom of primary Sjogren syndrome, affecting over 50% of patients. Sjogren's patients may experience pain in the joints that is similar to the pain of rheumatoid arthritis patients. Their joint pains may be symmetrical and may appear in the hands and the feet, but fortunately, the arthropathy of Sjogren syndrome tends not to be erosive or deformative. Sjogren syndrome patients may also complain of morning stiffness, which is a typical complaint of patients with rheumatoid arthritis. The arthritis of Sjogren syndrome patients may present with swelling of the lining of multiple joints. Just as in rheumatoid arthritis, this is called synovitis, and it may present in a symmetrical manner. In seronegative rheumatoid arthritis patients, that is, patients without the typical rheumatoid factor and ACCP anticyclic citrullinated protein antibodies that are characteristic of rheumatoid arthritis, this can be even more confusing. And anti-Rho SSA or anti-LA SSB antibodies, which are typically found in Sjogren syndrome, can also be found in rheumatoid arthritis patients, especially if they suffer from secondary Sjogren syndrome. Now, Sjogren syndrome can be divided into primary and secondary Sjogren syndrome depending on whether it appears by itself or whether it appears along with some other autoimmune disease. Rheumatoid factor can be found in about 40% of patients with Sjogren syndrome, but ACCP antibodies are far less common. Because of these uncanny overlaps, patients with Sjogren syndrome are often diagnosed with rheumatoid arthritis when in fact they have Sjogren syndrome. A second disease that can be confused with Sjogren syndrome is infections with hepatitis C virus. Patients with hepatitis C virus infections may develop dryness of the eyes and dryness of the mouth and be confused with patients who have Sjogren syndrome. In fact, it is believed that infection with hepatitis C virus can induce Sjogren syndrome and lead to inflammation of the salivary glands. One of the symptoms of hepatitis C infection outside of the liver is the development of mixed cryoglobulinemia. Mixed cryoglobulinemia is an inflammation of the blood vessels that can occur in hepatitis C infections. These are also symptoms of Sjogren syndrome. Patients with hepatitis C infections can also have positive salivary gland biopsies, which are diagnostic of Sjogren syndrome. Hepatitis C patients may also develop positive anti-Rho SSA and anti-LA SSB antibodies, positive rheumatoid factors, positive antinuclear antibodies, and develop swelling of the salivary gland. In some cases, eradication of the hepatitis C infection can cause the regression of Sjogren syndrome symptoms. Another shared complication of Sjogren syndrome and hepatitis C infections is the development of non-Hodgkin's lymphoma, a type of blood cell cancer. These findings have led the ACR, the American College of Rheumatology, to develop guidelines for the diagnosis of Sjogren syndrome that include the exclusion of active hepatitis C infection. The third disease that can be confused with Sjogren's syndrome is menopausal vaginal atrophy. With menopause, there's a drop in the production of estrogen by 95%. This causes thinning of the tissues in the vagina and leads to a decrease in vaginal secretion. The resultant vaginal dryness can cause pain during intercourse and lead to bleeding. These are findings that can be sometimes found in patients with Sjogren's syndrome. Clinicians may sometimes attribute vaginal dryness to menopause when it may in fact be coming from Sjogren's syndrome. Number 4, systemic lupus erythematosus, commonly called lupus. There is a significant overlap in the symptoms of SLE and Sjogren's syndrome. Patients with SLE can have many of the symptoms of Sjogren's syndrome and can develop the markers that are found in Sjogren's syndrome. SLE patients may have anti-SSA Rho or anti-SSB La antibodies, and this can make the differentiation between the two conditions difficult. SLE patients may also develop keratoconjunctivitis sicca or dry eyes, which is a characteristic of Sjogren's syndrome. Sjogren's syndrome patients may have the same genetic markers and may respond to the same medications that are used to treat SLE. In fact, because of this, many patients who were diagnosed with SLE may in fact have Sjogren's syndrome. Number 5, fibromyalgia. There are many common symptoms shared by fibromyalgia and Sjogren's syndrome, including fatigue, widespread body aches, dry mouth, and dry eyes. Both fibromyalgia and Sjogren's syndrome were found to have altered levels of cytokines in the blood. And many Sjogren's syndrome patients have fibromyalgia symptoms. In addition, in one study, over a third of fibromyalgia patients were positive for novel Sjogren's syndrome autoantibodies that appear before the typical anti-Rho and anti-La antibodies. Researchers have also found that patients diagnosed with fibromyalgia are at a higher risk of developing secondary Sjogren's syndrome than the general population. Many patients are told they have fibromyalgia without being tested for Sjogren's syndrome. If you found this video useful, give it a like, subscribe to the channel to support the channel, and until the next video, stay healthy and stay safe.